In this video, I'm going to show you how to release this part of your neck. Why would you want to release the upper cervical spine, which involves the C1, C2, or the atlas and the axis, or the suboccipital muscles that reside back here? Well, there's many reasons. If you have problems in those areas, it can cause a whole bunch of problems, from decreased blood flow to the brain. It can cause headaches, cervicogenic headaches. It can cause dizziness. In some patients, it might cause occipital neuralgia, where that pain shoots forward. It can cause visual disturbances, TMJ problems, autonomic nervous system dysfunction, a whole bunch of things. So I'm going to tell you, this video is going to be important if you have problems right here. Let me show you right now how to release this fast. I encourage you to follow along with me so you can feel what I'm feeling as I explain it to get the best results so you can start to release this fast. The first thing is a very simple stretch. What we're going to do, we're going to take our jaw and we're going to move our head in this direction. So I'm going to show you from all three sides so you get this. We're going to open up and pull up. So basically what we're going to do is pull and visualize a rope pulling up our head. It's going to open up the back. So we're going to hold. And the rotation is going to be like this from the side. So we're going to take our hands and then we're going to traction up with our fingers right on the suboccipital area. We're going to hold this for 15 to 60 seconds, up to a minute. Let me show you how to do this from behind. Come off the skull or the occiput, wrap your thumbs along your jaw, and as you pull, you're going to rotate the hands, put some pressure here, and pull up. Traction. Hold for 15 seconds at minimum, up to 30. That stretch is going to open and separate the skull from the top bones in your neck, and it's going to help stretch open that area. When you get it, you're going to have a little bit of pressure on there. You're going to feel a little bit of trigger point at the same time you're tractioning and opening up that space. Let me know how you like that one in the comments below. The next two are going to be a stretch and a strengthen. Most people always gravitate towards the stretch, and I get it. It feels tight. You should want to stretch it. However, oftentimes those muscles are tight because they're weak, and some other muscle might be weak. For example, here, your deep cervical flexors might be weak. So I'm going to show you a stretch and strengthen in this next exercise. For this next one, we're going to activate some muscles while we stretch. You don't need a small towel or a face cloth, but I'm going to use one here because I find it a bit easier just to help engage the muscles. What you're going to do is you're going to take a towel. As I say, you don't need one, but we're going to hold it here and you're going to press down with your chin to hold the towel there. So that's activating the muscles. And then you're going to rotate to the affected side. And then back. So what you're doing, you're activating the muscles as you rotate up. You're going to feel as you rotate those muscles and that area open up while you're firing some of the muscles that are necessary to help relax your suboccipitals. Let me show you from the side. You feel it right in here. Hold this for about 5 seconds and then go to the other side. Hold for 5. Hold for 5. Again, you can do it without the small towel. The small towel just gives you a bit of feedback so that you know you're firing the muscles properly. Let me show you one more time, just from behind. Feeling it here. Hold for 5. Feeling it here. If you've done both of those, the first stretch and now the active muscle activation plus stretch, you're feeling it already there. Don't go away though. I got one other one, and then at the very end I got a simple tip. If you just still feel after doing this routine or these 3 exercises that you still feel tight there and you need a little bit of help, I'm going to show you a simple trick to help loosen them up. So for this next exercise, it's going to look easy until you do it. Then you're going to notice how hard it is, but it's really effective in opening up that area behind your neck at your C1, C2, your suboccipital area. It increases blood flow to the brain. It's just a fantastic strengthening / stretch exercise. So again, very simply, get comfortable, hands just on your belly, make sure you're breathing appropriately through your belly. You're going to flex your neck up, and you're really going to take the chin and try to touch your manubrium or your sternum, and then you're just going to rotate. Hold for 2 to 3 seconds. So it's a flexion with rotation. What you'll notice, you're firing really important muscles deep down in your neck, but at the same time when you rotate, it's really opening up the suboccipital area at the back of your neck. You might only start with 3 sets of maybe 3 reps on each side, so 6 reps total, because it's actually very difficult. Difficult doesn't mean you shouldn't do it, because it's really effective. I'll do one more set for you. If you can't do multiple reps, you can basically break it down into 1 rep on each side. So up and then down. That would be a really good place for you to start. Now, if you're doing this with me, you're feeling it, you're lighting up because your brain is more oxygenated because you get more blood to the area, it's loosening up. But for those tough cases, I'm going to show you a simple trick that can help loosen them up either before or right after doing these 3 exercises. If you work through those 3 stretches / exercises and you're still a bit tight, then you might need a ball. This is a squash ball, but you can use a tennis ball, golf ball, any type of ball, and all you're gonna do is take it on the area and you're gonna rotate it around the tight side very gently to start. It's just gonna help massage the muscle to bring some blood flow to the area. I always recommend you do both sides. Do this for about 15 to 30 seconds. Works really well because it's a bit hard, but yet it's still soft. It can kind of get in the nooks and crannies, and when you go on to the skull itself, it's not painful. The only pain you're going to feel is if your muscles are a bit tender, but you can judge and you can come on and off how much pressure you put on it. If you want a little more control with the weight of your head, you can do this lying down too. Let me show you how to do that quickly, and just so you have an alternative to sitting. Okay, here's the ball. Set it down there. Get your head, and then you can kind of just rotate through, up and down. Again, a squash ball works good because it's not completely hard, has a bit of grip on it, and you can go through some range of motion in terms of rotation, flexion, extension, or you can just hold it in the one spot. You can control the weight by just the weight of your head, but really effective to help either start the 3 exercises or finish. So if you're struggling with tightness, restriction, headaches of either tension, cervicogenic, or migraines, if you have occipital neuralgia, you have jaw pain, face pain, eye pain, this routine will help alleviate some of that tension, open things up, get things flowing better, and I know you'll feel better soon. Let me know which one you liked in the comments below. I'll answer all your questions, and if you have ideas for future videos, put those down there too, because I love hearing from my viewers. If you're new to my channel and you like videos like this, I'll hope you'll show some support by giving me a thumbs up, and maybe you'll hit the subscribe button and notification bell so you can be informed when I upload a new video. And if you're a subscriber already, maybe you'll consider joining the channel so you can have a little bit more connection with me and a little input in the direction of my channel. I appreciate you tuning in. I can't wait to see you in my next video. Until then, stay well.